Hello, here's another episode of Instructions for Our Patients.
This is Dr. Jin Kim, and my name is Gabby, and today we're going to break down soft tissue surgery and post-op instructions.
Soft tissue surgery in clinical periodontics is a very common procedure. As you can see here, magically we brought back the soft tissue that's missing on this person's front tooth. And although the surgery looks very complicated, it's not. It's quite simple. It does require taking some gum tissue from the roof of the mouth many times, and here's a spectacular result that everybody is pleased with. Here's another example of a soft tissue surgery to make sure these muscles that get in the way and pull the gum away is completely freed away. So soft tissue graft comes in different sizes. Here's a case where we followed up the patient for 9 years. Here's a side-by-side of the case before and after. Lots of fun things that go into soft tissue surgery.
So as our patient, we want to make sure that we can help walk you through the post-operative healing because it can be a little bit daunting when you've never experienced a soft tissue graft. Now, you were probably told you have things like recession and there's just a huge area that lacks the soft tissue that it needs. So Dr. Kim is going to go and harvest that tissue from the roof of the mouth and get it where it needs to go. Now, we are going to give you some tools to help promote a good, predictable outcome to help the area heal much better. One thing we can do is use a cold pack. You're going to use an ice pack on the outside of the face, whatever side that we're doing the procedure on. The ice pack is really going to help control things like pain and the swelling. The bleeding is going to be the most critical thing to want to control at this point. We're going to want to make sure that we are doing cold rinses. You can even use an ice cube in the mouth to help let it melt and keep the area cold on a daily basis.
So cold rinses are very important, except unlike in this picture where the lady is bloating up her cheeks, you got to be a little bit careful. No stretching. We got to be very careful. So gentle cold water in the mouth, gently moving it around, spitting it out. It's the cold, it's not the water. So together with that, we also advocate using ice cubicles in the mouth. These are little big pieces, maybe some crushed ice, so you can put it in the mouth and just roll it around like candy. It keeps the mouth cold, the wound cool, less swelling, but you also hydrate yourself.
Another thing we can do while at home is to make sure that we're relaxing. We are not going to want to be doing any strenuous activities like exercise. Even household chores can increase our heart rate. It's going to promote more healing. The healing is what we're trying to stop and trying to minimize at this point. So we want to make sure that we just veg out, take it easy, watch a movie, and just drink something cool.
Yeah, we're going to talk about what to eat, what not to eat. But ice cream comes to my mind. Hey, we want something cold. We want lots of good energy and calories. So this is not the time to watch your diet. This is time to really just chill out. Order people around and have a ton of ice cream and sweet things.
Ice cream is awesome.
You have all the permission to do that from us.
So good. So make sure that you get your favorite ice cream from the store. Stock your fridge. That way you're ready to go for, when you come home after your procedure. Another thing we can do is use our Stella Life kit. You are going to be given this Stella Life kit to start before the procedure. You're going to use the spray underneath the tongue. The rinse is going to be used afterwards, and then the gel is actually going to go right underneath, right where the area is, and on the roof of the mouth.
As you see here, this is a commercially available product. You can purchase it on Amazon and straight from their website. They call it Intelligent Healing, and I've been using this product for our patients for going on almost 10 years now. It's a very excellent product. It has a lot of natural ingredient that's designed to do two things: accelerate the healing and bring the pain level, swelling, and the bacterial infection down. And it seems to do exactly that.
Dr. Kim, is it possible to overuse Stella Life?
No, the quick answer is no. This is natural product. This is not like a medication or medicine. So there's no right dose. The more you use it, the better. And here's the thing. And people get confused as to what are all these components. Well, there's 3 parts to it. The spray is the unique one. You spray this under the tongue. As you know, under the tongue there's a lot of blood vessels, and medications do get absorbed. So all the active ingredients here gets absorbed, gets the body ready to go into a healing mode. So this is usually done best the first thing in the morning, but I really don't put a restriction. You can do this as many times as possible. Every so often, after rinsing and keeping the cold, lift your tongue and spray. The second one is the rinse. Rinse is the most versatile because it's easiest to use, and it can go into all the nooks and crannies and tight spaces between the teeth and the wounds. So, to maximize the use, rinse the mouth with cold water gently, not to overstretch and so on. Brush the affected teeth as possible, and then just saturate the wound with the rinse. The third one, the gel, is a viscous type, and this is the one that can be applied directly onto the wound. The gel does hang around a little bit longer than the rinse, so this one seems to have a little bit more effect, especially for the soft tissue wounds.
So the way this works is you'll take the gel out of the box. This is what it looks like, and you're actually going to uncap. Sorry. Pause. Cut. You go.
Okay. So here is an example of a patient who actually had a soft tissue graft. The graft is actually in the side of the cheek that you can see. There are lots of brown structures which are stitches. And immediately after the surgery, I am applying this gel. And as you can see, you can swallow it. So we just lift liberal amounts of it.
So this is what the gel looks like. It comes in a tube just like this. It's really easy. You unscrew the top, and then you'll get the gel right in that area, either on the roof of the mouth or right underneath the tongue or wherever we're putting the tissue graft. You're going to want to apply this liberally. There's a lot in this tube. We can always give you more here at the office.
So, some people find it uncomfortable using the Q-tip or even a fingertip. If you use your fingertip, wash your hands really well, put a lot on your fingertip, and rub it on wherever you are. Another very easy way is to put plenty on the tip of the tongue and just kind of roll with your tongue. That way you don't have to stick your finger in the mouth, and some people find it very uncomfortable.
It has a clear and runny type consistency, so you'll want to kind of get close to the sink, try to not get it all over your face, but it does have a really good minty flavor, kind of like toothpaste, just a little bit more gentle, and it makes your mouth feel a little bit cleaner.
It doesn't taste too bad. You can clearly swallow and tolerate it pretty good. Now, real medication. The real medications that we use, and people are often surprised at how little medications we can use in this day and age. We use minimally invasive methods, and therefore antibiotic uses are common and quite much of a default, but secondary infections are extremely rare. I really can't count how many true infections we've ended up with patients undergoing soft tissue grafting in the last 5 or even 10 years. I don't remember any. So they are very rare, but it's a common way to cover. So you want to take antibiotics unless you have allergic reactions, and typically it's a full course of 7 or 10 days. But here's the thing. We don't really feel that antibiotics use are that important. So long as all the right healing takes place, within about 3 days, you can stop your antibiotics, and that's exactly what we do. 3 days of solid antibiotics is more than sufficient to do the job and prevent unnecessary infections, but also to prevent unnecessary overuse of antibiotics.
Now, Dr. Kim, what are we telling our patients to take for the pain?
Pain is always the much more interesting topic because people do get apprehensive. What if? Well, ibuprofen is our main medication in use. And when you look at ibuprofen, which is Motrin, Advil, and as you can see on the image here, Advil and Motrin over the counter is 200 milligrams. And we take it for headaches and all sorts of reasons. And most people say, that's not going to be enough for a surgery. Well, listen hard, because ibuprofen is actually in the group of medications called the non-steroidal anti-inflammatory medications, NSAIDs. When NSAIDs are used at slightly higher dose, 600 to 800, which is literally 3 or 4 pills of Advil taken together, but it does require a prescription, kind of silly. Yeah, so the 800 milligram that we typically give is 600 for people with weaker stomachs, but that gives you not only the pain relief, it actually relieves the swelling and has anti-inflammatory effect, and therefore think of it as accelerating the healing. So together with the cold, together with the Stellar Life gel and the rinses and whatnot, ibuprofen taken at that level is extremely helpful.
So, Dr. Kim, basically what you're saying is we're killing two birds with one stone, essentially, by taking the ibuprofen.
Right. People usually think that's just not a strong painkiller. That's not the case. Ibuprofen is used as an anti-inflammatory, and swelling really is the culprit of all the pain and sources of issues. So that's how we want to control it, together with the ice and the cold.
Are there any instances where we will not prescribe ibuprofen?
That's a very good one. Obviously, people that have allergic reactions and history to it, people that have chronic kidney failure, severe liver diseases, these are the main organs that the medication is broken down, so it's a clear contraindication. And people that have stomach ulcers, gastric ulcers are notorious. Ibuprofen will be acidic, and therefore it will worsen things. Now, what if you are in that unfortunate category? Then you're going to have to rely on Tylenol. Tylenol is quite effective, not as effective as ibuprofen, but it does tend to relieve pain perception, not the swelling. So if you're in this category, if you have to keep taking Tylenol, you have to overdo the ice and other methods much more. Tylenol. Acetaminophen. I can never pronounce this.
Acetaminophen, Dr. Kim. Acetaminophen.
I can never do this one. Okay.
Now, Dr. Kim, do our patients need a prescription for acetaminophen?
No, we don't. We can take the regular Tylenol. Sometimes we prescribe our Tylenol 3. That's the one that has codeine in it. As needed, sometimes that is needed. That's a good segue into the medications that are a little stronger. And of course, certain cases, we do need medications that are stronger. But having said that, in this day and age, we are very sensitive about narcotics overdose and opioids. That is a real issue in our society. So as a dental practitioner, we do not want to unnecessarily contribute to that mess. So we very, very much limit the narcotics use in our practice. And it's not a very difficult thing. We have only had to, I think, last whole year, I've only had to prescribe out 3 or 4 prescriptions in this category. So vast majority of people do not need narcotics.
That's amazing. Now let's talk about what we can eat. I know that this is everybody's big question. What am I going to be able to eat at home? What do I need to stock my fridge with? So let's go through each of the items we can eat. Eggs are good. Anything that's cold. Cottage cheese. Ice cream is a popular one. Mashed potatoes that are really soft. Even milk soaked with cookies is delicious. Like good snack. Smoothies without the straw. Applesauce. We want to make sure that we stay to cold, soft food, nothing too hot or that's going to be super spicy. This we're talking about, your noodle soups, anything like that. We want to unfortunately avoid at this time. This is because we don't want to promote any increase in temperature in the mouth. By increasing the temperature in the mouth, then it's going to promote more healing. So remember, no hot food, but also no spicy food. Unfortunately, spicy food is going to aggravate the surgical area. So you're going to have to put your Tabasco sauce, or in my case, Tapatio sauce, away and just keep it bland, keep it neutral.
Sriracha.
Make sure Sriracha's good.
Sriracha.
Keep it neutral, keep it bland, just for a little while as the area is healing. The time is going to go by fast. If you follow these steps, it's going to make it easier to get there. Another big one with soft tissue grafting, we're going to want to avoid crunchy food that's going to break up into a lot of pieces. Now, for all my chip Dorito eaters out there, yes, no Doritos at this time. No crunchy, hard food at this time.
No tortillas.
Tostitos, yeah.
Yeah. You can eat whatever you want to eat, so long as it's not hard, so long as it's not hot, so long as it's not crunchy. So that's the restriction.
Mm-hmm.
So we have a saying, anything that makes noise as you chew, you probably shouldn't be eating. That's a pretty general term, but something soft, something that's bland, something that does not have direct consequence on the wounds.
So let's recap really quick what we are trying to control. Okay, so we're trying to control the bleeding and we're trying to control the bruising. So by following these steps so far, we're going to make sure that we can minimize the bleeding and the bruising by using the Stella Life gel and by following these steps.
Bleeding and bruising are very rare in these types of procedures, but it does happen every once in a while. Now, let's talk about 2 different things. Bleeding, if it ever happens, we do need to put some pressure And biting down onto something does not work very well because usually the pressure is on the teeth and not necessarily the wound itself. So if you have an area that is likely to bleed, we as a team always point that out, and we will tell you exactly where it's going to be, the cheek, part of the jawbone, or the palate roof of the mouth, and we will tell you how and how much force to put on where and when. So please make sure you ask those pertinent questions, and many times it's not just descriptive. We will show you exactly where and how much pressure to put on so you understand. When pressure is put on, you don't do that with bare hands. We do that with a pad of wet gauze. So it's a cotton gauze that we give out. You want to saturate that with clean water or saline and then put pressure using your hand directly over the area to stop the bleeding. When the bleeding does stop, which sometimes takes 5-10 minutes, and as you take the cotton away, you've got to make sure it's wet so you don't unnecessarily peel or tear off some of the clot that's formed, which is very difficult to do. So you've got to be able to do that.
Okay, so graphic content incoming. We want to make sure that you understand this is just added for your knowledge as the patient to see what to expect, but generally we do not want you to look at the area as it's healing. Don't have anybody else try to look at it. Trust me, you don't want to see it, what it looks like while it's healing, but this is just to give you an idea of where Dr. Kim is getting the tissue grafting material from and how we want you to apply the Cell Alive gel.
Yeah, it's very common to get the graft harvested from the roof of the mouth, and this is an example of the same patient that we saw earlier on, but immediately after the procedure, we're putting some gel on there, and you can see some messy material sitting there, and this is just going to be a very quick slide. This is not the same case, but the middle slide shows kind of a jelly-like material. The image on the right side of the screen is 3 days later. Nice clot has formed, bleeding has stopped, and the wound is under control. This is what's known as platelet-rich fibrin. Some people like to call it concentrated growth factors. It's basically a concentration of platelets that we get from the patient's arm. We do this very routinely in today's world because platelets are this group of cells that magically contain a lot of growth factors. And when there's an acute injury in the blood vessel, they clump up, and their job is to do exactly that, so somebody doesn't bleed to death. But once we found out about this, it was actually the dental community that figured this out. We tend to artificially increase the efficacy of this by clumping all the fibrins through the platelets, and we basically applied it over the wound. This concept is very routine in our office. We've been doing that since 2000, 2001. In 2006, 2008, we came up with the terms sticky bone and concentrated growth factors. And ever since, we've been using this very, very routinely.
So again, let us remind you, we don't want you to look at the surgical area while it's healing. We definitely don't want you to see what it looks like as it's healing. Again, don't look at it. It's not pretty. Much like, you cut yourself on your skin and a scab forms. A lot of times that scab will dry up, turn brown. You leave it alone. It takes its time to heal, but new tissue grows underneath. The same idea happens inside the mouth, except it's not going to dry because your mouth isn't dry.
Don't look, don't touch, don't stretch, don't irritate the area. We have a lot of people that says, oh, I started to bleed, all of a sudden something happened, the stitches came off, all these kind of things. And normally we see some kind of activity that is unwarranted. So for instance, if you're out and you are with a group of friends, several days after the procedure, get into the habit of doing this. Somebody might make you laugh. She makes me laugh all the time. So I kind of have to say, don't make me laugh, don't make me laugh. Just minimize animation. All this sort of stretching all of a sudden is not very warranted. So be careful.
And don't do this. Yeah, don't do that.
Don't show it to your neighbor. Don't show it to your friends. Don't take a selfie for Instagram. Just leave it alone. We're going to look at it when we are back together in the office in a couple of weeks.
Okay, the next topic we're going to cover is how to maintain it, the area clean, as clean as possible while it's healing. So we're going to go over things like brushing, what to expect. You're going to be given a soft surgical toothbrush. This is a special soft surgical toothbrush. We're going to make sure we stay away from the tissue graft, away from the gum. as far away from the gum as possible. If you look at this screen, you'll look at the little yellow squiggly lines. Those are actually, Dr. Kim drew those himself. They are sutures.
They're stitches.
Yeah.
They're digital stitches.
They may not be yellow, they may be white, but at this point you'll want to make sure that you stay far away from that area.
Most of the time, these stitches will fall out in about somewhere between a week and 2 weeks. Sometimes we use non-resorbable, and those need to be taken out by using a small pair of scissors when we see the patient next. But most of these are resorbable, so we need to leave them alone so that they slowly dissolve away. If you unnecessarily fiddle around, put the toothbrush to it, touch and irritate, then they will fall off too quickly, and it will affect the wound healing. So that's what you got to be careful about. Brush only the biting surfaces and stay away from the wounds to not unnecessarily agitate them.
Dr. Kim, how long does it take for the stitches to come undone by themselves?
It's typically, we use what's known as chromic gut. Sometimes we use materials different, but typically they are about 2 weeks maximum.
Okay, so we know that we're not going to mess with the sutures. We're not going to pull or tug on them. If there is a little suture that's kind of sticking out and you feel comfortable taking a tiny pair of scissors and cutting them, trimming it, we encourage you to do that if it makes you more comfortable, but definitely don't pull.
Only if they're dangling, only if they're coming loose unnecessarily, it just gets irritating. But otherwise, leave them alone.
Okay, so we have soft surgical toothbrush as part of your arsenal to make sure that we keep everything clean. This is a ultra soft surgical toothbrush. Ultra, it's like super soft.
So there we have it.
Like
we will make sure that everybody leaves the office with them. These are very, very soft.
Yeah.
But even though how soft they are, they're still not designed to be directly in contact with the wound. So brush the teeth, brush the tongue. Just keep up the oral hygiene as best you can, but avoid touching the area directly. If it has to be, it's got to be only with the soft toothbrush.
Only soft toothbrush. Another thing to avoid are mouthwashes. You're not going to be using any over-the-counter mouthwash. You're not going to be using anything that, if you've come across this term called chlorhexidine, we're not going to use anything else except what we've instructed for you to use, which is in the Cell Life Kit. These can be very harsh and will not allow the tissue grafting to heal properly or predictably.
See, there's nothing magical about mouthwashes. If you think that these go and do a covert job where they go and kill up the germs, they do, but they kill everything it comes in contact with. Do understand that. It's just a very blanket, general, cell-hating chemicals. That's what they are. So they will not only kill the germs, which is what you need to do, but they will harm the wound. So this is not the time to use mouthwashes of any sort for the first 2 weeks or so.
As our patient, you're likely would have come across a term called home bleach therapy. We probably have already asked you to do it. This is when you take bleach and you put it in your water pick at a solution. It's diluted. You get it inside. Make sure everything is clean. After any surgery that we do here in our office, we're going to ask you not to do home bleach therapy for at least 2 weeks. You're going to kind of stop your daily regimen and just use the Cell Life Kit.
Yeah, please watch our other videos describing the Clorox home bleach therapy. Is a very, very effective way to keep your mouth healthy and keep you away from gum disease. But this is, again, not the time. Any chemicals using Listerines, Periodontal, home bleach therapy, we want to avoid all of that for at least 2 weeks. Give the cells a chance to heal. Okay, so we're going to go over the healing pattern. And I do apologize, it says LANAP. This is soft tissue. I want to make sure it's soft tissue. The healing pattern is the same for LANAP or any other procedures. Any swelling that pops on, and if the peak goes up and continues on, then really we have to say, what did I not do? Did I not take the ibuprofen properly? Did I not use the mouthwash? Did I not use the cold pack and cold rinses properly? Because if you do all of that as we have just described, you will have a small bump, small swelling for a shorter duration, and not for up to 2 weeks. And the exact same thing happens with pain. We want to hit it early, all the right things we've just described. We want to make that bump a little bit small and not last that long.
We all want to get back to our daily routine, so we encourage you to pause the video, rewind the video, watch it over again, make sure that you really understand the post-op instructions. If you can just baby it through for at least 2 weeks, then the healing, the outcome will be better for you, and then overall better for your oral health. If you have any questions at all, anything comes up, please call the office. We are happy to help you and walk you through step by step throughout your healing process here with our office.
Everybody here is happy. Yeah, we're happy to help you. We want to make sure all the instructions are clear. We do give out written instructions. We do go over this at least a couple times during your visit. But mind you, when you're in a dental office for a procedure, especially a surgery, you're going to be nervous. You may not remember everything. That's why we've created this video so you can go back and rewatch it, rewind it, and so forth. And we have other topics on our website, askyourperiodontist.com, and there might be other useful information on there, so please utilize it. And if you need any help, we are here to support you.
Yes.
So let us know. Everybody gets my phone number. Please use the phone number appropriately, which I am completely happy to receive them, but text me first. You don't know where I am. I do travel quite a bit, so text me so that I will know who it is and what's going on, and then I will respond accordingly.
If Dr. Kim doesn't respond right away, like he said, he does travel, don't be alarmed. He typically reaches out to myself or the office manager the next day, and we'll be in contact with you and walk you through step by step.
Thank you for watching this video, and we'll see you at another video.
Happy healing. I'm like, where's the camera? Oh!
Oh, there.